Hello, my name is Elizabeth Cordova, and today I'll be talking about Colorado tick fever. So, what exactly is Colorado tick fever? Some names you probably have heard of is probably mountain tick fever or even American mountain fever. It is a double-stranded RNA virus. It replicates in bone marrow and infects red blood cells. It also belongs to the genus of the cultivirus. So, some instances and prevalences is that you can see this virus more in the western United States or even Canada at elevations of 4,000 to 11,000 above sea level. Usually this virus is more high during the summer and spring months just because that's when ticks come out. Sometimes though you can see them in the fall, especially if it is a warm fall. A lot of instances have occurred when people want to go see the leaves changing. There are about 83 cases from 2002 to 2011, which is kind of a small number, especially given the amount of time. But the CDC has said that it is estimated about 150 or more people have gotten it every year. It's just a lot of people do not actually report the case because it's usually just um, it usually just lasts for a little bit of time, and it's also not required for people to report it except for then the 6 states that it is mostly seen in. So a lot of travelers probably get it, but then once they go back to their state, they probably just let it go through and not report that they have a Colorado tick fever or even know what that is. So what do these ticks look like? So Colorado tick fever comes from the Colorado or even Rocky Mountain wood tick. The males, as you can see in the picture on the right, are just all brown with maybe like a little bit of white streaking, but not much to be noticed. While the females have a little bit of white either somewhere on their back, usually at the top, and also has about a reddish brownish coloring under it or even around the white. These ticks can be about quarter to even dime size, so they're very small. And usually when people are looking for ticks, you might be looking for like a new random freckle that you've never seen before because they kind of just blend in. So when you are checking for them, you need to make sure that you're very thorough in your checking. So the way this virus is transmitted, as you can see on the picture to the right, is that so the tick will bite about maybe a small animal like a squirrel, a chipmunk, even a mouse who has the virus. The virus does not affect them in any way. It's just that they have it. So the tick bites them, feeds off of them, which the way that they feed is that they're feeding from the animal's blood. And so they get it. And as soon as they detach, they will have it and then they will pass it on to either a human or even a deer. Um, so they will bite you or the deer and they will transmit the virus into you or the deer through the open wound. So this virus is vector borne. The reservoirs, like I have mentioned, are the small animals and is the tick. There are some rare cases, though, of blood transfusions. So that is where an infected person hasn't waited the mandatory 6 months or doesn't know that they even have the virus, and they decide to go donate blood. And so your donated blood that is used on another person, it has the virus in it, so it is put into the person that is getting your donated blood, essentially. So some symptoms is that, of course, like all other diseases, you have flu-like symptoms. You have headaches, chills, fever, you can have body aches. There is usually a red rash that does happen, especially around the bitten area. You can have vomiting, you can have abdominal pain. So the incubation period is about 3 to 6 days since the bite happened. So as soon as you get bitten, it takes about 3 and 6 days to even show any types of symptoms. So the picture to your right is kind of like what the rash can look like. It can spread on the hands, it can be on the abdomen, it can be on the chest. It can just be about anywhere, especially around where the bite happened. Some complications that can occur but are very rare is that this virus affects the central nervous system, which I kind of found kind of fascinating because I didn't really know that it could do that. You can get encephalitis, which is an inflammation of the tissue around the brain. You can also get meningitis, which is the inflammation around the membranes of the brain and of the spinal cord, or you can get hemorrhagic fever. These complications, from what I've read, haven't really been seen in a lot of adults. It's mostly been seen in children, so they become very ill. It usually always requires for people to go to the hospital. Again, this virus does not have a high death rate. It's very low, actually, especially people with a lot of severe symptoms. So these complications can be very alarming, but sometimes not to the point of like death. So how does a doctor diagnose this? They can diagnose it through an antibody test. So they search for antibodies of the Colorado tick fever if they are present in yours. If they are, then obviously they can diagnose you with it. They can also diagnose you if the doctor does a blood count. So basically what it does is they measure the amount of white blood cells, red blood cells in the body. And because this virus does affect the red blood cells, they can usually see that the virus is in it. This virus also does affect the liver, so they usually do a liver function test just to make sure that the liver is working correctly. Just make sure that the liver is working correctly and the virus hasn't affected the liver to a very severe extent. So there really isn't a way to treat this virus. There's not like a vaccine for Colorado tick fever. Usually when you go to a healthcare provider, they might prescribe you some sort of medication that brings down your fever or that helps your body aches. It should go away though within 10 days. If it does not, then the CDC has requested that you should probably go to your healthcare provider again or even the hospital, especially if symptoms seem to be more severe. There is one thing with your fever is that it will be high for maybe about 2 to 3 days, and then you think you might be getting better because your fever goes down, and then again it'll spike up for another 2 to 3 days. But the CDC has said that as soon as the second spike happens, it usually lasts about 4 days and then should go away. Some ways to prevent it is that you should wear insect repellent when you're going on a hike or going camping, especially in a very woodsy area. You should wear long sleeves and pants, but if you're like me, it's a hot summer day, long sleeves and pants don't really seem like the ideal choice. So you should probably wear the insect repellent all around. The way you should spray it is that you should spray it all over your body, on your face, and also all over your head because ticks like to get into areas that are kind of dark sometimes. So sometimes they'll get under your clothing or they'll get into your hair. So spraying your head will help prevent that tick from attaching onto you. You should check for ticks frequently when hiking and or camping. So if you're like midway into your hike, you should probably just take a minute and just check your body as thoroughly as you can and have somebody that you're with check your head or just feel around. But as soon as you're done camping or hiking, make sure that you go home or wherever you're staying and go take a shower. When you're taking a shower, definitely check as thorough as possible. If you cannot, then have somebody else check your head and your body. Again, you are looking for something kind of small and something that's kind of like out of the place, especially because they do kind of look like freckles. When you remove these ticks, you need to remove them as immediately as possible, especially if they haven't already bitten into you. The way to remove them is that you should get tweezers, but you can use your hands if you do not have tweezers on you. You want to get as close to the skin as possible and as close to the head, and you want to pull straight up. You don't want to pull on either side or even twist it because you can run the risk of decapitating the tick, which means you left the head inside and it's still bitten into you, and it can cause an infection, and it can even still transmit the virus into you. As soon as you have removed it and you have made sure that the head is out, you want to make sure that you thoroughly wash it and maybe put some like Neosporin or disinfectant on it. So a recent occurrence about this, again, this virus isn't really reported as often as it probably should be, just because one, again, not very many people die of it, and two, people aren't really that concerned. But back in May of 2018 in Oregon, there were 4 cases within a month that happened, which kind of brought up a lot of red flags, especially because these patients were all over the age of 50. About 3 of them went to the hospital because of severe illness, but they all recovered. Like none of the patients did die. But this was enough to bring Oregon in, like raise some red flags for Oregon to do something about it and to investigate a little bit into it. So it's kind of discomforting, but again, death rate's not very high, so it's not like one of those viruses where everybody's like, oh my god, you have it. So, but that is my virus. Thank you.